And this lobe is responsible for interpreting all of our five senses that we take in.
Nendi migao no endo ochungne kao ote duto ma wuok kuonde ma opogore mag del ma ote wuokie.
The occipital lobe is in the back.
Nitie moro ni occipital lobe ma yudore chien e tok wichku.
And it processes the things that we take in through our eyes.
Kendo tije maduong' en ni oyango gigo eko ma odonjo kokalo kuom wengewa.
The temporal lobe is on the sides.
Nitiere moko ni temporal lobe ma yudore bath wich koni gi koni.
And it's responsible for our emotions and our memory.
Kendo tije maduong' en ni okano weche mopogore kendo gima timo machielo en ni en modhi lawa kaka wakawo gik moko.
So let's walk through an example of how the mind of maybe the people of God might function. So you come into contact and you see something that is evil. The occipital lobe is what takes in that image through your eyes. The parietal lobe tells you, ooh, this is evil. The temporal lobe may cause you to feel afraid or anxious about it. And the frontal lobe makes a decision that you will either turn away from that evil thing or you will continue to watch it. Sometimes we can't control what our senses take in. But we can always make a decision in our frontal lobe whether or not we will continue to expose ourselves to it. The mind can be a very beautiful thing, or it can even wound itself. One of the ways that the mind hurts itself is through negative thinking. When someone is constantly criticizing themselves or others. When someone is constantly worrying and thinking about something over and over again. When people are believing lies such as God doesn't love me or he's punishing me. When we hold on to feelings like unforgiveness and bitterness. When we hold on to feelings like unforgiveness or bitterness. These emotions, all of these things, thoughts and feelings are harming the brain. When things are allowed to stay in the brain, it can produce disorders in the mind. There are several different types of mental health disorders. For example, we have mood disorders.
What?
Mood disorders. Your mood is when you might feel happy or you might feel sad. Mood disorders include different types of depression and bipolar disorder. Bipolar disorder is kind of feelings of up and down in the mood.
Iwinjo ka gik moko ok beyo, seche moko gik moko chochni e yoreni.
You have anxiety disorders.
Nitiere chandruoge mabiro nikech gombo gik mabiro.
It's when someone is in a constant state of worry or panic or fear.
En thuolo ma ng'ato bedo ka oparore mang'eny kuom gik mopogore opogore.
We talked about trauma disorders before.
Nwawuoyo kuom gimiluongo ni trauma motelo.
And there are different types of psychotic disorders.
Nitiere kit chandruoge mopogore opogore mag obwongo.
Such as schizophrenia or schizoaffective disorder.
Kaka disorder mawachono.
These psychotic disorders mean that someone is not able to tell reality from what is real and what's not real.
Ne kit chandruok no en thuolo ma ng'ato onge gi teko mar pogo gima ber gi gima rach.
Then we have substance use disorders.
Nitiere chandruoge mabiro kaluwore gi gik ma ng'ato tiyo godo.
These are disorders that involve addictions to alcohol or drugs.
Magi biro kaluwore gi gik machalo kong'o kaachiel kod yedhe mamero ji.
Akin to the substance use disorders would be disorders of addictions.
Nitiere chandruoge mabiro kaluwore gi gik ma ng'ato ong'iyo tiyo godo maricho.
Such as addiction to betting or gambling.
Machalo kaka ng'ato hero gopunda kata timbe makamago.
And we will discuss those tomorrow.
Mago mabiro wuoyo odiochieng' makiny.
And also we have neurodevelopmental disorders or disorders that happen from birth.
Nitiere moko mayudo ji kaka ji medo dongo ng'ato samoro chandruok moro make chakre tinne.
And some of these include intellectual disabilities that can occur in children.
Moko chalo kaka nitie machalo kaka ng'ato ok nyal mako gik moko yo makare kopuonje.
Tomorrow we're going to have a testimony about someone living with this type of disorder.
Kinywa nayud neno moro kotenre gi ng'at moro mantie gi kit chandruok aina ni.
It'll be my husband.
En jaode.
When he was young, he was diagnosed with as a special needs child.
Kane pod otin nofweny en gi shida moro mar kit ng'ol moro.
He was told he was mentally retarded and could not learn.
Nonyise ni nitiere kaka obwongo ne ok nyal mako gik moko mapiyo koro nok onyal somo.
So he will talk about his story tomorrow.
Kiny no owuok kuom sigande owuon kiny.
So when we talk about disorders of the mood, I've mentioned bipolar disorder. There's also postpartum depression after a woman gives birth.
Nitiere kiwuoyo kuom chandruok mabiro kotenore gi mor kata kuyo kaka ng'ato samoro nigi chandruok ainano nikech noyudo nyathi kata okonyore.
But the main one that you're going to see is major depressive disorder or depression.
Maduong' ma wanang'e en gimiluongo ni depression.
And it's more than just a feeling of sadness.
En gima oyombo mana winjo ni ikuyo.
It's got to be not only sadness, but at least 5 other symptoms that happen over a period of 2 weeks or more.
Oloyo mana bedo ni winjo ni kuyo to en gik moko matimore kaluwore nyaka ndalo madhi 5 kata mokadho mano.
For example, you must have at least 5 of these symptoms over a period of 2 weeks to be diagnosed with depression.
Nyaka ibed gi ranyisi gi eki kuom ndalo madhi 5 koka inyalo wach ni in gi depression.
Sleep, issues with sleep.
Ka in gi chandruok gi nindo mari.
Poor interest, you don't feel like doing anything.
Ka okiwinj ka onego tim gimoro amora, ionge gi gombo mar timo gimoro.
Feelings of guilt or shame.
Iwinjo ka in gi wich kuot kata isiko iparo ichicha kodi wuon.
Poor energy.
Ka teko ni bende dok piny.
Feeling tired.
Iwinjo kiol.
Poor concentration, not able to focus.
Ok inyal chiko iti gimoro kuom thuolo mang'eny.
Disruption in appetite, either eating a lot or not eating enough.
seche moko in gi chandruok kata e chiemo, ok ichiem moromo kata seche moko ichiemo mang'eny mokalo.
Feeling as though you're moving more slowly in life.
Iwinjo ka gima gik mitimo mos mokadho.
And having suicidal thoughts of not wanting to be alive.
Kendo ichopo e paro ni koro onego bed ni deri kata ok ine ka onego bed ni medo dak e piny ka.
If you have any of these,
Ka in gi achiel kuom gik makamagi,
at least 5 of them,
abich kuomgi katin,
at least 2 weeks,
kuom kinde madirom jumbe 2,
you have depression.
nyiso ni in gi depression.
Tomorrow I'm going to give out a screening tool.
Kiny wadhi yudo idhi chiw gino ma wanyalo tiyogo mondo wanonre.
And you will be able to test yourself to see if you or if you know someone has depression.
Koro ibiro yudo thuolo mondo ipimri iwuon kata ipim ng'ama chielo ka be en gi depression.
And if you get a certain score, you will need to seek help. If you get a certain score when you do the test tomorrow, you should seek help.
To nitie gik ma ka ineno kanyo to onego imany konyruok, onego imany kaka ikonyi.
I want to speak a little bit about postpartum depression. Postpartum depression.
Ida wuo matin kuom gimiluongo ni postpartum depression.
Because sometimes we think that after a woman has a baby, it may be natural for her to be tired.
Samoro waparo ni tok ka ng'ama miyo oseyudo nyathi kata osekonyore to en gima ong'ere ni nyaka obed mool.
But it's very helpful to watch out for excessive depression like what we just discussed in a mother who just has had a child.
To en gima kare mondo mi non kendo ng'ini to ng'ama miyo nene okang' machal nade. Dipo ka samoro depression mar oidho.
Postpartum depression happens very much in single mothers and in mothers who are teenagers.
Nikech depression aina ni yudore mang'eny ahinya kuom mine ma odak kendgi to nigi nyithindo kata ma omako ich kapod tindo.
And most people never think about it. It's never screened.
Kata kamano ji mang'eny ok timnegi pim.
So we want to look out for that in new mothers. We want to look out for postpartum depression in new mothers.
Wadwa rango postpartum depression ni kuom mine matindo.
When we talk about anxiety disorders,
nwawuoyo kuom bende disorder ma iluongo ni anxiety disorder.
There's a general anxiety that people have.
Nitiere kit anxiety ma ji duto nigo.
People can have social anxiety where they don't like to be in large groups.
Jomoko nitie ma ok gomb no bedo e kidieny mar ji mang'eny.
People can have feelings of panic.
Jomoko nyalo bedo ka chunygi chandore.
It feels like a heart attack.
Magi winjo mana ka gima gin gi heart attack.
Or people can have what we call phobias. Phobias.
Jomoko nigi luoro.
Phobias are feelings of intense fear.
Gin luoro moko ma odhi mokalo tong'.
Like for example, some people have fear of being in public places.
Nitie jomoko moluoro bedo kuonde ma ji ochokore mang'eny.
Or fear of spiders.
Jomoko luoro kata otieng
Or snakes.
kata mbui gi thuonde.
All of these have names, but they are phobias.
Giduto gin gi nying-gi kata kamano giduto iluongo gi ni luoro.
Let's see here. Let me get to the psychotic disorders.
Wadhi kuom gimiluongo ni psychotic disorders.
So about 1% of Kenyans struggle with psychotic disorders.
Ni chandruok aina no ji atamalo achiel mar jo Kenya mangima ni kode.
This is not just disorders of seeing things or hearing things that aren't real.
Ok en mana gino ma otenre gi winjo kata neno gik moko ma ok timre ngima.
You can also have delusional disorders.
Inya bedo gi chandruok mar gik ma buogi.
Delusional disorders involve having a fixed false belief.
Oting'o gik ma chalo kaka bedo gi yie kuom gik ma chutho to gionge ti yie kuomgi.
For example, I had a patient that thought that a famous person was in love with them.
Kaka nen gi case moro mar ng'at mane paro ni ng'at moro marahuma ahinya nikode hera kata here.
This was not true,
To noken gima adieri.
but they really believed it.
To ne en gi yie kabisa kuom wachno.
Or I also had a patient that thought that they themselves were famous. That I had a patient that thought that they were famous.
Nitie bende jotuo manobedo go ma ne paro ni gin joma rahuma.
But this was not true.
Kata kamano ok ne en adier.
When we talk about periods of psychosis,
Kiwuoyo kuom thuolo mag bedo gi psychosis,
drugs such as cannabis can trigger psychosis.
Yedhe mamero ji machalo kaka njaga nyalo keto mondo wabed gi chandruok ainani.
And sometimes you can have disorders that are caused by drugs.
Seche moko inyalo bedo gi chandruok e obwongo ma yedhe mamero ji gima okelo.
For example, you can have cannabis-induced schizophrenia.
Seche moko inyalo bedo gi chandruok moluongono mokel gi yath miluongo ni njaga.
And this means that a drug caused you to now have a psychotic disorder.
Tiende ni yath marachno omi bedo gi shida mar obwongo machalo kamano.
We talked a little bit about developmental disorders, and we'll talk a little bit more about them tomorrow. But tomorrow you're going to hear a testimony about autistic spectrum disorder.
Nwase wuoyo matin kuom chandruoge mag obwongo mabedo ka wamedo dongo, mabende moko kunywa wuok kuom gikiny.
So autism spectrum disorder is a developmental disorder that causes people not to communicate well.
Ne kit chandruok ainano mar obwongo en gima chandowa mondo kik wayud thuolo mar wuoyo makare.
And it's a spectrum, meaning that everybody that has the disorder, they don't look the same.
En gino manyiso ni ok ji duto man gi chandruok ainano ma nenore ka gima gin joma chalre.
For example, you can have someone who's very successful, who's done very well, that has this disorder.
Seche moko inyalo yudo ka nitie ng'at motimo maber e gimoro ma bende ni mana gi chandruogno.
And you can have someone that can't even learn to read that has this disorder.
E seche gogo be nitie ng'at moro man gi chandruok ainano ma ok nyal kata somo.
They have difficulty reading social cues.
Gin gi chandruok e nono kendo somo gik mopogore opogore.
So for example,
Kuom ranyisi,
other people may be laughing and think something's funny,
jomoko nya bedo ka nyiero kendo gineno ka gimoro kelo mor moro.
but people with autism spectrum disorder, they won't understand why everybody's laughing.
To joma nigi chandruok ainano ma chandruok makamano gin ok gibi ng'e tiend gimomiyo ji nyiero.
They also struggle with sensitivity to senses.
Gin gi chandruok nyaka ne migepe mag dendgi ma winjo ka gik moko lokore alwora margi.
So for example, we might hear different sounds around us and it not bother us.
Seche moko wanyalo winjo ka nitiere duonde moko mawuok machiegni kuonde ma wantie to ok chandwa.
Or we might eat different foods and the texture doesn't bother us.
Seche moko wanya chamo chiemo mopogore opogore to kaka kit chiemo no chalo ok ochunowa.
But people with autism spectrum disorder, they are very sensitive to those things.
To joma nigi chandruok ainani gin gik makamago gi nono kendo ging'iyo matut e alwora margi.
I think we talked about dementia last time. I think we did. But I just want to say, dementia looks a lot like depression.
Wacho ni chandruok miluongo ni dementia nendi chalre gi depression.
So in the elderly,
Kuom jogo ma ikgi oniang',
you can have someone that looks like they're depressed,
nitie ng'at minya neno ka gima en gi chandruok e obwongo ne en gi depression.
and they have all the symptoms that we just talked about, sleep, energy, and so forth.
Kendo en gi ranyisi moko mane waseneno chien kacha e weche mag nindo kaachiel gi mamoko.
But they're also having some memory issues.
Seche moko bende gin gi chandruok mar ni gik ma donjo e pachgi ok nyal moko makare.
And it's dementia, not depression.
Maniluongo ni demential depression.
So let's talk about the S, or the spiritual component of our 5 parts to wholeness.
Wang'i anena wach namba 5 mar gik moko 5 manonego bed ni wang'iyo kuom yo mwanyalo bedo godo makare e yore duto.
So sometimes when people see mental illness, they say, immediately, oh, that's demon possession.
Ji mathoth koneno ng'ato ka nigi tuo mar obwongo to giwacho piyo piyo ni ng'ano nigi jachien.
But we should never assume that someone is demon possessed.
Wawacho chien kucho ni kik ipar piyo piyo kamano ni ng'ato nigi jachien.
We should never shame them or frighten them.
Ok onego bed ni wakuodo wigi kata wabwogogi.
And we should always seek medical counsel as well as spiritual counsel.
Onego bed ni wamanyo rieko mopogore opogore mag weche mag thieth kaachiel kod mag weche mag lemo.
If you see that someone has a gradual change in their mood or thinking,
kineno ka ng'ato nigi lokruoge mopogore opogore e kaka oneno gik moko,
they've had a history of some sort of loss or sickness or trauma. They've had a history of loss, sickness, or trauma.
Seche moko gisebedo gi weche machalo kaka trauma e kit ngimagi kod tuoche mopogore opogore.
And it improves with treatment.
To ineno ka lokruok moro bedo godo kaka imedo thiedhi.
With rest, with food, with support.
Koyudo yueyo, chiemo kendo ikonye.
This is likely an illness.
Seche moko nyaka bed ni maendi en tuo.
A lot of times people have been mistakenly labeled as demon possessed.
Nyadi mang'eny ji osekaw e yo moko winjore ni gin gi jachien.
When it's really one of these.
Ka e seche go to en achiel kuom gik makamagi.
If a person is sick with an infection or a fever,
ka ng'ato nigi tuo mar gimoro chande kata ni en gi koyo moro donjone.
If they are intoxicated with drugs or alcohol,
ka seche moko semadho kong'o moro kata en gi kit njaga moro semadho.
If they have epilepsy or seizures,
samoro gin gi shida mag ndulme kaachiel kod goruok piny.
If they have psychosis because of some sort of brain infection like malaria or meningitis,
seche moko gisebedo gi tabu mag malaria gi meningitis.
All of these medical conditions can make someone look like they're demon possessed.
Tuoche gi duto king'iyo gi tibo neno ka ng'ato chalo gima en gi jachien moro.
And we know in the Bible you can have both.
E muma ibro neno ka mago duto nitie.
For example, the son of the man that came to Jesus, he came to him because it looked like he was having seizures.
Nikech kaka sigand wuoyi moro mane babagi odhir Yesu ne odhire nikech nyathino ne gore piny kasto otetni.
But the Bible makes it clear that he did have demon possession.
Biblos wacho maler ni ne en gi jachien.
It's very important for us to understand that the Bible does not condemn mental suffering.
Gima nyaka wang'e ni muma ok okwero bedo ni ji nyalo bedo gi tuoche mag obwongo.
We remember that Elijah, he was so tired and burnt out.
Wanyalo paro ni Elijah bende ochopo okang' mane ool kendo nojony ahinya.
He was ready to die.
Noikore kendo nogombo tho.
But God gave him some food and rest.
Nyasaye nomiye chiemo kaachiel kod yueyo moro.
We see repeatedly how David is crying out to God in anxiety and distress.
Waneno nyadi mathoth kaka Daudi bende ywak ni Nyasaye kool kendo ojony e ngimane.
We talked about Hannah earlier.
Ne wawuoyo bende kuom Hana motelo.
And we know the story of Job, how he was sitting in grief.
Wang'e bende kaka Ayubu bende noromo gi chandruok ma nobedo ka pache ochanore ahinya.
The one thing that we must unlearn is that not all suffering is punishment from God.
Gima nyaka wang'e ni ok shida duto kata chandruoge duto ma wan godo gin mana chwat ma kuom Nyasaye.
Not all pain is weakness. Not all pain is possession or weakness.
Ok rem duto ma wan godo e kit ngimawa nyiso ni wan gi rem kata yomyom moro.
And we are to approach the situation with compassion and grace. We are to approach the situation with compassion and grace.
Onego waranga okenge go gi yo mar muolo moro makende.
According to Ministry of Healing,
kaluwore gi book mar Ministry of Healing,
nothing tends more to promote health of body and of soul than does a spirit of gratitude and praise.
Onge gima ber kendo mamoro chuny mar dhano kaachiel kod ringre moloyo gino miluongo ni goyo erokamano to gi pako ng'ato.
It is a positive duty to resist melancholy or depression, discontented thoughts and feelings. It is a positive duty
En tim maber kata en tich makare mondo mi wakwer gimiluongo ni
but you could say depression.
Watamre gimiluongo ni depression kuom paro kachiel kod kaka wawinjo gik moko e ringrewa.
And one of the ways we can do this is through the concept of resilience.
Achiel kuom yore mwanyalo timogo gigi en ka wanyalo bedo gi ritruok kata rito.
Resilience is the ability to adapt to suffering and hardship.
Tiende ni wanyalo romo gi chandruok to wanyalo mana ng'iyo kodgi.
Whereas perseverance allows the person to get back up again when they fall.
Kinda nyiso ni ng'ato nyalo chako chung' malo kendo kata obedo nopodho.
This is a part of what we call a growth mindset.
Maeri e okang' miluongo ni bedo gi paro madongore.
A growth mindset means that even if there are difficulties, hardships, and trials, the brain is able to not only adapt but to thrive.
Tiende ni paro madongore tiende ni ng'ato nyalo bedo ni samoro opodho to pod ogeno mana ni pod obiro mana yudo thuolo mar chung'.
The brain says, even though I'm tired, I will keep trying.
Paro kata obwongo nyisi ni kata obedo ni aol tabiro siko katema tema.
Whereas a fixed mindset says that I can't do it.
Ka paro mochung' kar kanyo to nyisi ni kama chope ni koro kanyal dhi mbele onge gima nyalo time.
I can't get better.
Onge kaka nyalo yudo konyruok kanyo.
And people are stuck in hopelessness.
Kendo ji dong ka koro gionge geno.
Factors that help us bounce back when we are struggling
Gigo mamiyo wachak wachung' malo ka wan e chandruok
is to change our perspective in how we see the world.
En loko paro kaka waneno gik moko e piny.
It's to make sure that we don't isolate ourselves but surround ourselves with caring people.
En ni kik wadong ka koro wachung' kendwa to wabedo machiegni gi jok manyalo ritowa kata konyowa.
And it's to choose positive coping strategies that we're going to discuss tomorrow.
Kendo yiero gik moko mabeyo minyalo kopo kuom ji makiny wanang'i kiny.
So how do we know if someone has mental illness or if they're just struggling with normal life issues?
Ere kaka wanyalo pogo kind jogo ma nigi chandruok mag obwongo to gi jok ma neno pek gik moko ma pile pile nyaka rom godo.
The way you know if a mental illness exists is in these three things.
Kaka ifwenyo ni nitiere tuo mar obwongo kuom ng'ato en kuom gik moko adek gi.
The first one is it lasting a long time? Is it lasting a long time or does it have a long duration?
Mokwongo ni nyaka ipenjri ni gino endo mineno kuom ng'ato obudho kuome maromo nade.
Is it severe?
Pek mare to chal nade.
And does it affect your activities of daily living?
Koso ere kaka chocho yore ni mag timo gik moko mapile ka pile.
If these three things are present, there is mental illness.
Ka gik moko adek gi kinenore kuom ng'ato to iwacho ni en gi tuo mar obwongo.
So you need to seek help if something is lasting for weeks and not getting better.
Onego imany konyruok kata kony moro kamoro ka dipo ni gimoro matimore kuom wige mang'eny to onge lokruok minene maber.
If it stops you from working or going to school or doing your hygiene.
Kotami kuom timo tijeni moko kendo tami dhi sikul kata timo ler mamagi.
If it makes you feel hopeless and not want to be alive.
Ka otimi bedo ni paro ni onge tiendi dak e piny kae.
That is mental illness and you need to seek help.
Mani luongo ni tuo mar obwongo kendo ne gimany kony.
It becomes an emergency when people start to talk of killing themselves.
En gima rach ahinya ka ng'ato ochopo okang' monyalo wacho ni onego koro gidere kata ginegre giwegi.
Or if they've stopped taking care of themselves to the point where they're not eating or drinking.
Kata ka gitamore ni koro ok gidhi chiemo, ok gidhi metho.
If their physical safety is at risk, that is an emergency. You must get help.
Ka ok idewo kit ngimani mar ringri ma oko, mano en gima lich ahinya kendo onego imany konyruok.
When we talk about our acronym PATH,
Nwang'iyo gimoro bende miluongo ni PATH, acronym.
Or Ingia. I just gave that to you. Ingia, right?
Oh, yeah.
Yeah. The P is perceiving illness, understanding illness.
Pino chungne fwenyo ni ituo.
But in order to really understand illness, you have to understand and see God clearly.
Mondinge ni in gi tuo nyaka ine Nyasaye makare kata maler.
And it's important to know when you're struggling with mental illness.
En gima kare mondinge thuolo ma in gi chandruok gi tuo mar obwongo.
Because when we struggle with mental illness, it causes us not to see God clearly.
Nikech ka wan gi chandruok mar obwongo kata tuo mar obwongo to otamwa neno Nyasaye kendo fwenyo Nyasaye makare.
If we are afraid, it may be because God doesn't seem near.
Ka wan gi luoro to chal ka gima waparo ni Nyasaye ok ni machiegni kodwa.
If we feel shame, we might feel as though we're unworthy.
Ka wiwa kuot to chal gima waparo ni ok waromo.
When we start isolating ourselves from others, we might feel that God doesn't love us either.
Ka wapedo mopogore kendo mabor gi jowetewa to waparo ni samoro Nyasaye be ok oherowa.
And so one of the main reasons to get help
Achiel kuom gik momiyo nyaka wamany kony
is to make sure that we see God clearly.
En ni mondo mi okonywa mondo wane Nyasaye e yo maler.
That when we start to doubt his love and his acceptance for us,
mondo kika wabed gi to bedo no herowa kata gi kony momiyowa.
That we seek to change our perception.
En ni mondo wamany kaka wanyalo loko kaka waneno gik moko.
So you must seek help if your view of God is changing.
Nyaka imany kony moro maber kaka ineno Nyasaye dwa pogore kawuono.
We see how Job experienced this.
Waneno kaka Ayubu nokadhe wechegi.
And God was very quick to redirect him as to who he was.
Kendo Nyasaye notimo mapiyo mondo mi onyal gae katang'one ng'ama en.
He didn't tell him why he was going through the trouble.
Ne ok odewo nyiso Ayubu gimomiyo okadhe chandruogego.
He was just there to remind him of how powerful he was.
Temo mana paro ne teko ma Nyasaye nigo.
And when we remember that fact, a lot of things will ease in our lives.
Kendo kwa pare yorno to gik mang'eny dhi bedo mayot e ngimawa.
So the three things we want to learn this afternoon is, we've already stated that. I want to carry this forward on the acronym of BEAMS: the body, the environment, the activities, the mind, and the spirit. And I want you to keep these 5 things in mind as we do some role-playing scenarios to make sure we've learned, okay?
Adwa ni ket gik moko abich mosepuonjore gi ngimani kwa dwa ni mondo watimie tugo matin mondo gigi osike pachi.
Okay, so I want you to, I need 2 volunteers.
Adware ji moko ariyo mochiwore.
2 volunteers.
Ji ariyo moko chiwre ane.
Okay, I have 1, and then I need another one.
Saneno ng'ato achiel, ng'ama chielo.
Okay, thank you.
Erokamano.
Okay. So I'm going to give you a scenario. Can you stand in the front here so they can see you?
Adhi lero ni wach moro.
And you are going to be the friend of this person who is struggling.
Idhi bedo osiep jal ma nigi chandruok ni.
And his mother brought him to you with this complaint.
Min gi nokele iri ka en gi ywagruok ni.
You are his friend, so she's hoping you will encourage him.
In osiepne koro min osiepni paro ni biro konye kata biro jiwe.
So the mother brings him to you and says, over several months he has grown withdrawn.
Ni min gi okele iri to ng'isi ni kuom dweche abiriyo
withdrawn.
Osebedo ka gik manotimo koro weyo.
He stopped washing himself.
Tinde ok oluokre.
And now he hears voices.
No?
Now he hears voices.
Tinde owinjo awinja ka jomoko luonge.
The family believes he's cursed or demon possessed.
Jonyuol ne paro kata wede ne paro ni jachien moro gore kuome.
And wants to take him for deliverance.
Kendo gigombo ni gitere mondo mi ogol ne jochiende.
What would you say to him?
En ang'o ma ibiro kone?
What questions would you ask
Gin kit penjo mage ma ibiro penje
based on what we have discussed today?
kotudore gi gik mwasepuonjore kawuono?
Thank you. Can you talk?
Yes. And you can ask whatever questions, and we're going to evaluate, are you handling this in the way that we have discussed today?
Wadhi nono ka be inyalo konyo gima chal kamano kaluwore gi puonj mwaseyudo kawuono.
Okay, thank you. When if he is my friend, like you say, and the mom comes, and because me personally I don't believe that taking somebody to someone for deliverance before the assessment, I will ask the parent, and if he can also talk, I can ask him some questions. Number one, I will know the cause. When did it start? What happened in the past? I think I will actually access the history of the friend, and through the answers I will receive, I hope I will get something in between to help me to know the cause of that issue. Why can he not bathe? Is there water there or not? Or whether he learned that from a fellow, and maybe he knows the reason why he's not doing what he's supposed to do, like bathing. Why is he withdrawn? Like, why is he looking so he's maintaining wrong perception of individuality, singularity? I will try to check on what makes him or the mother, what the problem between them. Have they quarreled in the past? Has he engaged in any offense that made the mom maybe to hate him once a time? And maybe to access even what does he eat? When does he come back home? What does the brother watches? Or what is his way of doing what is called exercise, or maybe how does he uses his lesser time? And what kind of friends do you have? Where do you meet?
Absolutely.
So there are so many questions
Yes.
you can access going to.
Absolutely.
Yeah.
So you want to answer some of those questions?
Nyaduoke penjo moko.
Tell him what's been going on in your life. This is make believe, but go ahead and tell him.
My life.
According to
this story that we're trying to learn from.
Kiluokri.
You can make something up.
Oh, I make something up.
Yeah.
Okay. Okay. I don't know where to start from, but okay. I assume he's now the doctor.
No, he's just a friend.
He's a friend. Okay. Okay, when I'm talking about my friend, I think I'll get to tell you, like, the reason why, as a person, maybe I don't breathe, what really troubles me, the changes that I've experienced in my body, the changes that I have in relation to the environment that I'm in, like the activities maybe that I find strange, like in terms of my mind or perception, intellectual capacity. How is it? Does it reduce? Am I like quick thinker? How is it? Is it like deteriorating? And also in my spiritual life, do I see any kind of improvement, or am decreasing spiritually?
Excellent. So what is the most, he just told you all of that. What is the most important question that you could ask him at this point?
It is a principle in the Bible that he who believes can be saved. And if anyone confesses with his own mouth, then God hears and forgives. And the verse I will ask my brother again, are you ready to make a change? Do Do you want to go back to where you were before, normal perception of things? And the mom also, I will ask the mother, that are you ready to take responsibility to help your son to go back? Or you are still going to continue criticizing what he's doing? So I think I must first ask him if he's ready to take action to go back.
So I like that. Before, okay, yeah.
Ahero kako wache no.
Before you get to that point, though, you have to assess if he's safe. So the first thing you must ask after he tells you all this is, are you thinking of killing yourself? Because what if he says, yes, I want to make a change. And then he goes home later. And you plan to help him sometime later in the week. And then he goes home and he acts on that feeling. And he hurts himself before you're able to help him make the change. So you always want to assess for how urgent is the safety matter. The spiritual assessment is after you have made sure that they are safe. And this is the most important thing when we're doing medical missionary work. We don't want to be so spiritually minded that we miss the very obvious safety concerns that are there.
Medical missionary work
you want to make sure that he can live to see another day to take those next steps. All right. Do you all have any questions?
I think thank you for that. That addition or what should be taken care of first. But I think we can only help when the victim is willing. Yeah, and also you will be having easy work when the victim himself or herself is working together with you. When us we have to work together with Christ to be saved. I think it is very important. Thank you.
Let me comment on that. When it comes to someone's safety, they do not have a say-so when it comes to mental health. They do not have a say-so when it comes to mental health. When someone says they want to kill themselves, they have surrendered the right to make a wise decision. And you can call for help. Despite their will, you can still call for help to help them. People die because family members step back and respect their decision. So in the field of mental health, there are 3 things that a patient loses their rights to make a decision on. If they are threatening to kill someone, they do not have a right to make that decision. If someone is threatening to kill themselves, and if someone is not eating or drinking or doing something to cause themselves to die, we have the responsibility to go get help, to try to stop them from making that decision, so that they can be nursed back to health, then they can have the will to get better.
To eka ginyalo bedo gi gombo mondo mi gidhi maber.
So it's very important that we respect people's will and decision,
En gima kare mondo mi wachik itwa ne dwaro kata gombo mag jowetewa,
but not when they are asking to die or threatening to kill someone else.
to ok ochopi okang' ma koro ng'ato dwa dere kata dwa nego ng'ama chielo.
You must intervene in those situations.
Nyaka idonjri e wachno e okenge ainago.
And you might not be able to restrain them,
Seche moko ok inyal gayogi kata geng'ogi,
but you can go get help.
to kata kamano inyalo ringo mondo imany kony.
Does that make sense? Okay. All right. Thank you. You guys were great. Thank you very
Erouru
much.
kamano ahinya.
All right. I want to go through what the possibilities could have been in that friend situation.
Adwa ni mondo wadhi anena e gima okang' ma kamano ne nyalo chopoe.
So if someone is all of a sudden hearing voices,
E thuolo ma ng'ato nyalo tho winjo awinja ng'ato wach moro ma onge,
all of a sudden they're not bathing,
ipo mana ka tinde ok giluokre,
all of a sudden they're withdrawn from family.
ipo mana ka opogore apoga gi anyuonde.
Possible clues could be they might be suffering from epilepsy.
Achiel kuom gik ma nyaka ichejgo ni seche moko ginyalo bedo gi ndulme.
They may have an autoimmune disease that's affecting the brain.
Ginya bedo gi chandruok mag rateke mag del ma chandore kendgi giwegi e dendgi.
That's when the body's own antibodies start attacking the body.
Ni ka gik ma rateke mag del monego konywa ema koro chak kedo gi ringrewa.
They could have a brain infection.
Ginya bedo gi tuo moro e obwongo,
Like tuberculosis
kaka tuo mar kahera
or HIV.
kata ayaki.
They could have a brain tumor from cancer.
Ginya bedo gi kansa mar obwongo.
They could have thyroid issues or vitamin deficiency.
Ginya bedo ni gikoso madini moko ma del dwaro manyalo chandogi.
They could be dehydrated or have electrolytes that are imbalanced.
Seche moko pi ma gikoso e dendgi kata ginya bedo ni electrolytes mag dendgi ma ok odhi maber.
And they could have heavy metal toxicity.
Seche moko ginyalo bedo gi chumbe mapek machalo mercury mang'eny mopong'o dendgi.
Okay. Am I out of time? What was he telling me? Am I out of time? 10 minutes. Okay, gotcha. We'll be done in this. Okay. So the reason why I wanted to give that scenario is that you see there are many things that could make a person present that way.
Gimomiyo ne wakelo ranyisi no en ni onego wang'e ni nitie gik mang'eny ma ng'ato nyalo bedo ni kadhoe.
And our friend told us that he would try to ascertain the cause first.
Osiepwa nowacho ni onyalo kuongo manyo gimokelo chandruok mokuongo.
Okay. I think I will stop here because it's done here. Do we have any questions?
Wabiro we gi kanyo nikech weche go rumo gi kanyo. Ng'ama nigi penjo?
Yes.
I have two questions based on what we learned in the Bible. And my first question, we learned of the 4 types of defense mechanisms of childhood trauma. Thank you. I have 2 questions. My first question comes from the defense mechanisms that we talked about. The last one that you said was healthy was humor. And I was wondering whether, because I learned somewhere of a mechanism where a person laughs when something is painful. Yeah. Maybe we are talking about something that is sad and we're talking about something that is serious. But being that the person has childhood trauma and was never allowed to express his own high emotions, the person laughs even when things are sad. So I was wondering whether they are the same.
So I'm trying to understand your question. Your question is, if someone is using humor as a defense mechanism, how do we know if that's healthy or not in that context? So you know it's healthy if, number one, nobody else is being hurt by it. So for example, I'm dealing with a defense mechanism, but I'm making fun of you and I'm hurting your feelings. That is not a healthy defense mechanism. But let's say I'm dealing with hurt and pain, but then I'm thinking of something funny related to something I see outside, or, a bird that's, acting silly, or a butterfly, or something that's harmless. And I use that to cheer myself. But it will never be where you are hurting someone else at your expense just so you can feel better. So that's the difference. Does that make sense? So it's not humor that's used to hurt other people. It's innocent humor that is inward directing to lift your mood. That's a great question. Mm-hmm.
My second question is, how can I differentiate nail biting from, I mean, situation where people bite their nails is when thinking about something deeply, when stressed or when traumatized, especially when childhood trauma. So how can I know that this type of nail biting is related to just a normal thinking, stress, or childhood trauma? Thank you.
Yeah, so nail biting in and of itself is not something that is concerning. For example, you can have someone with a cough and maybe they just walked into some smoke and they've coughed. Or maybe you have somebody with a cough that is just clearing their throat. Then you could have somebody with pneumonia that has a cough. So a cough in and of itself is not telling us much information. You want to understand what was the cause of that cough. So for example, there are self-injurious behaviors that are very serious. So for example, people will cut themselves, not to kill themselves, but because they feel like that gives some relief. Or people will pull their hair and they will literally pull out their hair to the point where they're bald in certain spots. People will pick their skin. We call skin picking. When that behavior starts to destroy the body or cause damage, that's when we know that it is serious. But nail biting in and of itself is not something to be concerning. But what it will do is it'll prompt you as the friend to say, you know what, I noticed that you bite your nails a lot. Is there anything going on in your life that I can help you with, or anything going on that you want to talk about? Or you could ask, it seems like you bite your nails a lot. Are you anxious about anything? So that can open the door. But nail biting in and of itself is not going to tell you whether or not they had trauma, not going to tell you whether they're depressed. It's just a symptom. And it could be 100 other symptoms. But it would be, as a friend, our job to just ascertain, you seem anxious to me. Is that so? And if so, do you mind telling me why, how I can help you? So does that make sense?
The reason I was asking that,
Uh-huh.
you can just kind of someone just biting the nail, but another person goes to the extent of, unless going to the fleshy area.
Yeah. So if a person bites their nail to that degree, that's an example of self-injurious behaviors where it's bleeding or the nail is like down to the flesh. That's when you want to ascertain, okay, it seems like there's some self-injurious behaviors. They're not doing it on purpose. It's a nervous tic or a nervous habit. You want to get to the root of why that is. And then you want to not only get to the root of why that is, but help them stop that. For example, maybe put some cayenne pepper there. So every time they, go there, they're like, oh, okay, So you definitely want to ascertain the cause, but also help them stop that behavior simultaneously if you can. Mm-hmm. Was that helpful?
Those are the solutions for that.
So you're asking for solutions to something that's not the problem. The problem is not the nail biting. The problem is whatever's causing the nail biting. So the solution to nail biting is figuring out what is the cause of the anxiety behind that's driving that nail biting. That's the only way to get the solution to the nail biting. Putting the cayenne pepper or things like that, that's just something to kind of help them with the behavior, but it's not going to stop the behavior. What will stop the behavior is to understand what is the trauma or the anxiety. What was the initial incident that caused them to start feeling this way? It could be that they are nervous taking tests. It could be that when they go home at night, the father, is mean to everyone and yelling, and they're always in a state of, being nervous. It could be a million things that's causing the nail biting. So you need to get behind that to see what is the thing that's causing the nervousness. Yeah. Anything else? Oh, yes.
Just asking that you can find a child grinding his or her teeth while you are asleep. Is that a mental disorder?
Say that one more time.
You can find a child while sleeping grinding her or his teeth.
Grinding
Is that a
teeth.
mental problem?
Not necessarily. Many people grind their teeth when they're asleep. It's subconscious. It could mean that they are nervous, but it doesn't necessarily mean that. It could just be a kind of a nervous tick, but it doesn't have to mean that they have a mental health issue. Okay, Miss Diana has some.
Can also be an indication of parasites.
Could be an indication of parasites, Miss Diana said. There are a number of involuntary movements of muscles that can cause tics and involuntary movements. So the first thing would be to get them a sleep study. That's the first thing. In a sleep study, the doctors can look at your pattern of sleep, when you are sleeping. Are you getting enough oxygen? Are you going into the proper, there are 4 stages of sleep. You want to make sure that your body is healing during those 4 stages. So there are many other factors that are going to be involved in that. So my recommendation for someone dealing with that would be to get a sleep study and see what's going on during the sleep, because there are a lot of other things probably going on in those 4 stages of sleep other than the grinding of the teeth that we just can't see, but you can see it in the brain through a sleep study. Okay. All right. Any other questions? All right. Well, thank you so much. And tomorrow we are going to get into the A of our acronym.
Erokamano ahinya kiny wanayud thuolo mondo wadhi kwachako gi A acronym mane wasepuonjore.
Which stands for assessing ourselves.
Ma ochung'ne gimiluongo ni nonruok kendi wuon.
We're going to take some tests.
Wadhi timo pim moro.
These are private.
Ma en gimitimo kar kendi.
And it will just give you the opportunity to know whether or not you or someone you know should get help.
Kae tidhi fwenyo ka onego iyud konyruok koso in aina kare.
All right. Thank you very much.
Erokamano ahinya.
Yes. All right. Let's have prayer. I don't need the mic.
You're not trained.
We can just have prayer. Okay.